Hello, my name is Jolene Castro, and today I am creating this video for remediation of an insertion of a Foley catheter in a female patient today. For the purposes of this video, I will be starting after cleansing the perineal area. So I'm going to start by performing hand hygiene and putting on some clean gloves. After cleansing the perineal area and my clean gloves are on, I'm going to be checking for skin integrity. I'm going to be checking for any redness, any irritation, any inflammation, any discharge from my patient. After checking skin integrity, I'm also going to be checking, identifying the urinary meatus. After identifying the urinary meatus and checking skin integrity, I'm going to be removing of my gloves and redoing hand hygiene and obtaining my Foley catheter kit. I'm going to be removing of the packaging there. Now that I have my Foley catheter kit, I'm going to start by opening my Foley catheter kit furthest away from me, two sides, and closest to me. I'm going to be obtaining my sterile gloves and opening these up away from my field. Still maintaining that 1-inch border all the way around. To put on my sterile gloves, I'm going to be starting with my dominant hand and grabbing the cuff of my sterile glove while still maintaining that cuff all the way around. Now that my dominant hand is on, I'm going to be placing my non-dominant hand. I'm going to be using 2 fingers and placing that glove on. While still maintaining that cuff all the way around. So now that I have my gloves on, I'm going to be creating my sterile field. I'm going to be starting with my drape. Ma'am, do you mind lifting your hips? I'm going to be placing a drape under you. I'm going to be placing this drape shiny side down. Now that my drape is placed, I'm going to place my fenestrated drape as well. Okay, ma'am, the procedure will begin in just a second. I'm going to be start my procedure by cleansing the area one more time. I'm going to open up my swabs and remove of those from the packaging, placing those on my kit there, discarding of that. I'm going to open the lube and place that down, discarding of that. Also grabbing my syringe and placing that on my Foley catheter. Now that that is done, I'm going to be removing the catheter from its sleeve, discarding of that, and placing that in some lube. Now that my catheter is placed in some lube, I'm going to let my patient know that the procedure will begin. Okay, ma'am, I'm going to be starting by cleansing the area. You're going to feel it a little bit cold. Now that my non-dominant hand is touching my patient, it will not move from that area. I'm going to start by cleansing my patient, the furthest labia away from me. I'm going to swipe down there, discarding of that. Next, I'm going to be cleansing the labia closest to me. Swipe down, discarding of that, and down the middle. Swipe down, discarding of that. Okay, ma'am, now that the area is clean, I'm going to be inserting your Foley for you. You might feel a little bit of discomfort. Feel free to bear down. That should help a little bit with that. Okay, now I'm going to be inserting my Foley catheter into my patient, identifying the urinary meatus. I'm going to insert my Foley 3 to 4 inches. After seeing urine, I'm going to insert it another 1 to 2 inches. Now that my catheter is inserted, I'm going to use my hands to secure it in place and inflate my balloon. Okie dokie. Going to remove the syringe and the start of that. Now that my balloon is in place, I'm going to tug slightly, make sure that it's secure. I'm going to also secure the Foley below the bifurcation onto my patients. Secure it there. I'm also going to obtain my Foley and secure it below the bladder onto my patient's mattress of the bed. Now that the urine is being expelled, I'm going to check for color, consistency, output, if the urine has any cloudiness. Now that the Foley is inserted and the urine has been checked, I am going to remove my materials from my patient, cleanse her a little bit, and discard of any materials that I've used. I'm going to remove my gloves. Okay, ma'am, are you feeling comfortable? I'm going to make sure that my patient is feeling comfortable. If she needs any repositioning, I'm also going to be doing that. I'm going to make sure that the call light is placed by her. Ma'am, if you have any questions, please feel free to press the call light and I will be in with you shortly. I'm going to redo hand hygiene and document my procedure today. Thank you.